Hi everyone, how are you doing?
Hey everyone.
My name is Asfura. I am 1 month away of finishing medical school in Honduras. I'm actually doing my social service in this missions hospital, Hospital Loma de Luz.
My name is Gerardo Padgett. I am a general physician. I've been here in Loma de Luz for about 9 months already. I started as a Servicio Social, which is the last step in Honduras medicine to be able to become a doctor. Finished that on the 4th of March. After that, I was offered to stay here, which I absolutely loved the opportunity, and I'm happy to be here, and I'm happy to be able to stay here and help out.
I really enjoy medicine. Everything in my life actually revolves around medicine, and I am very into medical education and content creation. I try to create videos and guidelines and just tutorials for medical students who are beginning their journey, or maybe they're on their 4th, 5th, 6th, 7th year of med school. In Honduras, we have 8 years of medical school. We're trying to figure out how to become better doctors, how to become better students, and how to use the opportunities through different settings, different attendings, especially opportunities like doing the social service on this specific hospital. I'm also a musician. I play the piano, I play the drums. At one point I tried learning the guitar, but I figured out it was too hard for me, so I just gave up. But I'll probably coming back to that in some months or in some years. I also like doing sports. Actually, my favorite sport to play is basketball. My favorite sport to watch is just football, soccer. Of course, I love adventures, so anytime that you have any activity like hiking, going swimming, going to the river, canopy, rafting, whatever it is that involves adrenaline rush, and count me in.
I do like to play soccer a lot. I like to go to movies. I like to spend time with my daughter. I think that would be my favorite hobby of all. I do like to practice medicine. I find myself in the hospital even when I don't need to be here, just because, I don't know, maybe I can give a helping hand to somebody that needs it at that time. So I'm always there to be able to help. I like to hang out with my friends as well, go to the beach, and I love cooking. Even when I'm eating, I'm seeing cooking shows and learning a little bit more to be able to prep better meals. Me and my friends and my loved ones, because I enjoy cooking that's for somebody else.
I began medical school in August 2014. As I mentioned before, medical school is 8 years in Honduras. And in that path, we do our internship inside of med school. So we finish our clinical years, which are 5th and 6th year. Then we do our internship, which is pretty much doing 3 months, in intensive 3 months on the 4 different big areas. So OBGYN, pediatrics, internal medicine, and surgery. I did all of that in public hospitals of the country because I studied in the National Public University, which is pretty much free. I think for the 8 years I just had to pay around $500 without counting buying my own books and uniforms and all of those things. But just for the sake of studying and being registered in my university, it was just around $500 for the 8 years. So I did that, and my internship was one of the best experiences in my life because in the hospital where I did the internship, we didn't have any residents, so pretty much the interns, we were pretty much the 1st or 2nd year resident. We were the first assistants to the surgeons in the operating room. We were the ones in charge of the emergency room, so personally, I would decide on management of patients. Let's begin CPR, let's push adenosine on this patient, and just take these very big decisions as a medical student, although I was already an intern doctor, a junior doctor. I would say I was always inclined to become a surgeon, but that has changed a bit on this 6 months of doing my social service. And really one of the main things that have pushed me forward to continue going in med school is, one, I really love serving people. I love feeling useful and just seeing patients that have been going for months or days or weeks or years with this and this and this things, and knowing how I can help them thanks to the wisdom God has given me. So I feel very useful, and I feel that people is really thankful here in the country because we are used to doing medicine without many resources, many medications, many exams to determine different diagnoses. So with whatever we can do, with whatever we have in hands, it's really helpful for every single patient we see.
Med school as you might imagine, was tough. At the beginning, or right in the middle, it had a lot of downs for me, which, thank the Lord, He was able to help me to overcome them. I really enjoyed myself whenever I was in a surgical rotation. I think I like those the most. But yeah, there are a lot of struggles that are involved, a lot of late nights studying. Sometimes you don't get as much sleep as you would like to. But at the end of the day, I think it's worth it. I really found myself trying to spend the most amount of time in the OR as much as I could, even in my free days. If God lets me be able to apply to a residency program, I definitely think I'm gonna opt for a surgical residency. I'm leaning towards orthopedics right now, so if that's what God has planned for me, then I'm willing to follow Him that way and be able to help more people.
I grew up as a church kid. My parents are pastors, so I grew up in church all my life. I was a pianist at church, youth leader, all different type of activities you would expect. And at some point I got lost in the way, especially when I got to med school. I was just so tired all the time. I didn't have any time to continue going to church. I had to stop playing the piano in church. And as I mentioned, I just feel I started getting lost in that path, and started questioning God a lot of days, and in a lot of things I didn't think were right, or things that were happening to friends of mine or in different parts of the world. So I was just asking, like, why is God allowing this to happen, or isn't God supposed to be good? And there were a lot of thoughts and a lot of dark periods of my life I had to go through. And surprisingly for me, once I started my social service here at this hospital, Christian setting, it's all a missionary hospital after all, I started hearing about God again, thanks to Dr. Harris, to his father, and all the other missionaries here. Of course, I knew a lot about the Bible. I had done studies in the Bible, and I just grew up in it. But I had never experienced it the way I have experienced it here, or the way I have been approached by God here. And I just feel it's really amazing how one can come back. And I was telling this reflection about a week ago in our Friday debriefs that we have at the hospital with the other physicians, and I just feel like a son coming back home, just as a story from the Bible. And I'm so thankful with God for making me go into His path again, and just feeling His presence, feeling His love, feeling that He's doing work through my life, through my testimony, through my medical skills that He has given me, and just helping here in the hospital, helping in the local church. I've been playing the piano here, been playing the drums from time to time. We have tried to put together a band from the physicians here in the hospital, so I think it has been amazing. And I am so thankful for being at this hospital in particular because of all the medical education opportunities I've had. Here I have seen other type of medicine, a medicine that is focused on healing the patient medically and trying to speak to their soul. The experience I have had with the attendings here is just very encouraging to continue studying, to continue improving. They congratulate you. They think you have done a good job, and I had never been congratulated before. Maybe just I could count them with the fingers of my hand. And it feels very rewarding. It feels like a very human medicine and a very warm setting where to be a doctor and be serving people. It feels more than a job, more than a hospital. It really feels like a community. It really feels like a family, like a support system for whenever things are not going good. So all I can say is thank you. Thank you for the opportunity to be here. Thank you for your support. I wish I could be doing so much more things to support this hospital. And I really wish and I really hope that whatever plans God has prepared for me, that eventually I can help this hospital grow, I can help in the missions field, and I can just help serve God's purpose on this earth. So thank you so much.
So coming to Loma de Luz, at first I didn't really know much about the place. I heard about some patients in La Ceiba when I was doing my internship year about Loma de Luz, but very little, to be honest. And how I ended up here, I think it was God opening doors to be able to be here. I think I am where God wants me to be. It was a blessing, to be honest. And Ever since I stepped inside the hospital, I like how the environment, the working environment, the people, how the patients are. They're so grateful. Just being able to help people that live in such an underserviced area here in Honduras, where we are located, is actually helping a lot of people from the surrounding areas. And being here, I don't think it's just about treating the physical part, but it's also about treating one's soul, one's heart, one's spirit. Because we do focus a lot on the Word of God, and we actually start our mornings usually with prayers. We also do some worship. I think that's just amazing, and that's not something you don't get anywhere else. And it's been such a growing experience, because over the years, it's been like a roller coaster ride in my life with my relationship with God. But since 2018, the 21st of April, God made a real change in my life. I mean, He's always been there. I just wasn't able to see Him, or wasn't even looking for Him. But ever since that day, things have been totally different. Everything has been better. I've been able to see how He has worked in my life, even in the little details. I think even being here is part of those blessings. I hope that He can use me as an instrument to be able to help other people as well, through my profession and my experience and my testimony. It's been such a blessing to be able to be here. From the bottom of my heart, appreciate it. So thank you.